The pandemic introduced many of us to the concept of telemedicine. When we couldn't get in to see our doctors during the pandemic, we connected online.
And now doctors here in the U.S. are using that same technology to try and help COVID patients in hard-hit India. The Fox Medical Team's Beth Galvin introduces us to a Gwinnett County cardiologist connecting virtually with patients more than 8,500 miles away. It's all part of an online effort to help patients stay out of the hospital.
Dr. Srini Gangasani has lived in the U.S. for decades, but he grew up in southern India and he went to college and medical school there. And for the last few weeks, he has been working overtime trying to help India get through this COVID-19 crisis.
10 o'clock was our tea break.
It's nearly 10 on a Thursday night, and Dr. Srini Gangasani, a Northside Hospital Gwinnett cardiologist, is grabbing a cup of chai tea in the kitchen with his wife Madhavi and their daughter Suma, getting ready for another late night.
Yes, they speak Telugu, English.
He's already worked a full day, but for the next few hours, Dr. Gangasani will be seeing COVID-19 patients virtually.
Where are you calling from?
He's at home in Duluth, Georgia, and they're at home about 8,500 miles away in India, sick with the coronavirus and trying to stay out of the hospital.
So what they feel is anxious. They're isolated. They're in the room by themselves. Okay, when each person just get a little bit more cough, a little bit more fever, they get anxious. Okay, am I getting sicker? Do I need to go to the hospital? That's where I think our doctors are helping them, just to educate them that, hey, this is okay. Your saturation is okay. Let's just watch it.
As India's COVID-19 crisis intensified, Gangasani and some of his American colleagues who grew up in India started connecting, trying to figure out a way that they could help.
And we started noticing that so many people going to the hospitals and so many people are dying. So the death rate went like, 3,000, 4,000, 5,000 every day.
When Gangasani's father got the virus, he worked the phones, trying to keep him out of the hospital.
Then my mom got sick a week later. So then my brother got sick a week later.
They all recovered, but many others are still struggling, as are many Indian hospitals.
When so many people get sick at one time, you cannot take care of all the patients. The same thing happened in US, same thing happened in Europe, same thing happened in many countries. Feverish or headache.
So with his wife's help, Dr. Gangasani is working with other volunteer doctors from the American Association of Physicians of Indian Origin and the nonprofit Siwa International to provide virtual house calls for COVID-19 patients in India through the new online platform eGlobalDoctors.
My whole family got COVID.
The physicians volunteer to take 4 or 5 hour shifts at a time, and the consultations are free and open to anyone who needs help.
Okay. I'm glad though your dad had a really mild infection. I'm really happy. I think you really did a good job. We know what we're doing is really a drop in the ocean, but I think each drop counts.
And since they launched their platform earlier in May, Dr. Gangasani estimates they've helped about 1,500 COVID-19 patients in India. For your Fox Medical Team, I'm Beth Galvin.